Hi, and today, have you ever felt na naay sakit sa likod sa imong lukon-lukon likod sa imong tuhod na ay nipitik so ni snap siya and then di nimo mapiko maglisod na ka og piko sa imong tuhod. Sometimes di sa kakatulid so you cannot bend the knee. Sometimes it's very difficult to straighten it. You feel like it's being locked in one position. For some patients, they can actually feel on and off. Sometimes no pain at all. Sometimes sakit kaayo. Especially when you're bending, especially when you're walking on uneven surfaces. Kanang gitawag dili patag na gilakawan nila. So, unsa man ni siya? What are these symptoms? Do you have them? Naa ba kay kaila na naay sakit sa lukon-lukon? Sakit sa likod sa tuhod, sakit ipiko, di nila matulid, and nikalit lang. It just suddenly happened na na-twist nila maybe, or when they were walking up or down the stairs, something snapped. And now, very difficult to bend or straighten the knee. There's swelling, and sometimes alsahon pa kay sakit kaayo ba. If you have these symptoms, this video is for you. Hi, good morning. This is Dr. Flordelis. Today we are going to discuss pain at the back of the knee. Sakit sa lukon-lukon or behind the knee, posterior. If you have knee pain, hubag kayo mong tuhod, swelling here, and when you feel the back of the knee, siya'y mass. So some of the patients think, basig na ay tumor in the back of the knee or a cyst. This can be seen in examination in the clinic, and usually the symptoms are very specific. Sakit ipiko, so pain when you bend the knee. It's also pain in uneven surfaces, kanang dili patag na lakwan. If you're walking in the long distance, it can also cause pain. Could it be arthritis? Yes, it can be arthritis, but it could also be something called a meniscus. So what is the meniscus? It could also be this here, in between the thigh bone and the leg bone. There's actually a space in the x-ray. If you've seen x-rays of patients, the meniscus is actually a cartilage, and this cartilage is the shock absorber in between the thigh bone and the leg bone. And that cartilage can be torn, so it feels as if naiugat. There's something na naputol or napukto inside the knee. That is commonly the feeling that the patients get when they have torn their meniscus. And why is it painful when they bend? It's actually painful when they bend because when the knee is straight, there's a big space in between the two bones. But when you bend the knee, so this is the side view, if you bend the knee, maipit yung meniscus. And if it's torn, you have more pain because this usually doesn't have any pain, but the capsule is stretched and the pain usually does not go away. And for some patients, the pain goes on and off. The pain is not continuous. Sometimes it swells and sometimes mawala ang pain. That is because I think of the meniscus like this. If this paper is your meniscus, it is torn. Sometimes there's no pain, but it is also sometimes it becomes painful when you move. So the pain is on and off, and because of this on and off motion, more frequently than not, the meniscus tear gets bigger through time and causes more symptoms. Again, this is pain on bending, especially in the back of the knee and pain. It could also be muscle injury, of course. It could be arthritis, of course. But again, the best way is to see your orthopedic knee specialist. Come to the clinic. We will check out your knee if it's really a meniscus tear or not. Again, this is the meniscus. Here, it's in between the thigh bone and the leg bone, the femur and the tibia. And what do we do for patients with meniscus tears? We usually don't get an x-ray. We have these patients get an MRI scan and to see what we can do for that patient. Here is a sample of a patient with a meniscus tear. I'm going to share with you a procedure called arthroscopy. So it's a small camera that goes inside the knee The camera is actually smaller than a ball pen that goes inside the knee, cleans it up, and after this, the patients are home walking. It's an outpatient procedure that you can do. Get in the hospital in the morning. Once the anesthesia is gone, walk home. And this is one such patient.
Yeah, sure. Tanaw na nato how she feels comfortable.
Feel na po sa kuan.
There's a little bit of clicking, no, pero wala na yung pain when you walk. Yeah.
Wala na dyan.
Wala na dyan pain. Sige, sige. Hadlog na lang.
Hadlog po sa clicking ba?
Yeah. Ang atong buhaton is kadong brace ni mo has
Brace,
this.
mag-brace gamit yan.
Yeah, para sa clicking. Pero you're doing well. Sige.
Okay. I'm just not as confident sa...
mabalik ka.
Okay, tampo ko niya.
Mabalik na natin tayong confidence. Actually, nindot na kayo mong walk ko.
Ay, salamat sa Diyos.
Very good, very good.